Right now, budget battles are bogging down in Washington, D.C. We're expected to feel the impact right here in Missouri and Illinois.
Senators are plodding along on a marathon vote over the future of Medicaid, food assistance, and tax policy. Our political editor, Mark Maxwell, has a closer look at the impact to your bottom line. Mark?
And the politics here. Senator Eric Schmitt in the Trump White House, they're selling what they see as upside in the big, beautiful bill, but their projections are built on a bunch of big, beautiful ifs. If tariffs don't backfire, and if tax cuts spur new economic growth, and if they can find more spending cuts, and if slashing more regulation pays off down the road, and if taxing wind and solar doesn't drive energy prices higher, then all those ifs combined with this bill, they argue, would have the effect of, quote, supersizing hardworking Americans' paychecks. 72 million Americans living in or near poverty use Medicaid health insurance to see a doctor, fill a prescription, or cover medical expenses. But in Washington, citing the nonpartisan Congressional Budget Office, Senate Democrats estimate more than 500,000 people in Illinois and more than 250,000 in Missouri could lose those benefits under the One Big Beautiful Bill. 1,100 of them receive care here.
We are watching this and monitoring it very closely because it could have a tremendous and profound impact.
Cindy Owens is president and CEO at UCP Heartland. The nonprofit published these videos to show what's at stake for adults with intellectual and developmental disabilities. She calls Medicaid their lifeline.
So any type of reduction whatsoever would have a profound impact on them because that would essentially reduce services. If the funding is not there for people with intellectual and developmental disabilities, then that means we would be reducing our services.
Missouri taxpayers could feel the pinch too. The state budget relies on billions in federal payments to cover the provider tax, something this bill targets and shifts to states.
We're going to have to find that money somewhere. Taxpayers are going to have to backfill if we're going to maintain the quality of services, particularly for individuals with intellectual and developmental disabilities, but also all 13,000 of our children that are in foster care are also Medicaid recipients.
6 weeks ago, Senator Josh Hawley initially wrote, "Don't cut Medicaid," calling that idea morally wrong and politically suicidal. One estimate shows 4 at-risk hospitals in rural Missouri and 9 in Illinois could feel pressure to close. The nearest, Parkland Health Center in Bonne Terre.
We've delayed that in this bill, but it will, unless we take further changes or take further steps, it will happen in future years. And I'm opposed to this.
But he says he's voting for it anyways. Missouri Democratic Party Chairman Russ Carnahan calling the bill a, quote, slap in the face. He hammered Josh Hawley in a statement saying he, quote, tried to have it both ways by pretending to oppose a bill that he now says he'll support.